and the individual who is showing this action sort of get aroused, or their intense sexual need is gratified by viewing the discomfort of the individual. Now, there will be multiple efforts where they do try to control it. They will try to seek help, but then usually it's in vain. So, exhibitionistic disorder is what we're going to be talking about next. Now, in common terms, we say flashing or exhibitionism. Now, this is a disorder. It is categorized under paraphilic disorders in the DSM-5. What happens here is that the individual has this intense sexual need to flash someone, and most of the time the gratification that they get in exposing their genitalia is either through the surprise or the discomfort that the victim usually shows. Now, this is not planned. They do not plan in advance that I want to flash someone, I want to flash this person. No. But the individual is very discomforted by the feeling that they have. But knowing the social consequences, knowing the policing consequences it can have on the individual, yet they have to do it because the urge or the intents to expose is that much. Now, the victims of such flashing or exhibitionism, they're never targeted. It just happens, and the individual who is showing this action sort of get aroused, or their intense sexual need is gratified by viewing the discomfort of the individual. Now, not everybody who flashes or portrays exhibitionism has this disorder. There are certain criteria that one has to follow, and almost for 6 months the individual has to go through this need, this intense need to flash someone. Now, while it might seem as a very policed issue, it is also something that the individual cannot help. That is, the individual feels discomfort. The one who is showing the act is distressed. So this is reflected in their occupational area, their physical area of functioning, even in their social life. Now, there will be multiple efforts where they do try to control it. They will try to seek help, but then usually it's in vain. So the individual who would come for consultation would usually give a history of failed attempts at trying to control. And even after flashing, even after they are gratified, there is a sort of guilt or overwhelmingness that they feel. Now, when we talk about this disorder, there is an intense sexual urge to expose their genitalia, and this urge is something that cannot be controlled. And second is the act. Even though they have this urge, they have to act on it. It is something that they have to show to somebody else in order to feel gratified. And thirdly, the gratification does not come primarily from the act, but from the response that they get from the victim. Now, the victim, like we said before, is usually a complete stranger. It is not exposed to anybody who they know personally, and this happens suddenly. So that sort of shock, that sort of surprise that they get is what gratifies the individual. Now, like we mentioned before, this act is compulsive in nature. No matter how much the individual tries, they find it very difficult to hold it in, so they have to show it. Now, this can also be based on sexual fantasies. An individual having this disorder will engage in a lot of sexual fantasy, and therefore the act that they do can come out of it as well. And finally, like we said, one of the main criteria is that it causes them a lot of distress. While there is a sort of gratification that they hope for, post that gratification, there is a lot of overwhelmingness, a lot of guilt, a lot of regret that is involved. Now, when we look into treatment plans for an exhibitionistic disorder, in terms of therapy, what we go with is CBT. So in CBT, like we said before, you analyze the thoughts, you see where it's irrational, you see where it can be altered. So helping the individual to manage their intense sexual urges is what is first aimed and noticed at. And once we direct attention to that side, helping them to control these urges to a large extent will either delay or help them reduce and eliminate that act of wanting to flash. Also looking into psychotherapy, looking into underlying causes, if there is a need, if something has happened in their childhood to, wanting them to flash all the time. If something like that does come up, that is also something that we look into. We have anecdotal evidences and other evidences that show that a lot of the individuals who develop this disorder later on has gone through a sexual trauma, has been abused, has been assaulted when they were younger, and later on they have developed this as a coping mechanism, or some sort of gratification happens because of that. Now, when it comes to medications, there is no particular medication for exhibitionistic disorder. But like we said, comorbidities can develop. The regret and the guilt that comes about later can develop into certain mood disorders. So we help with medications in terms of managing these side symptoms. It can be anxiety, it can be mood disorders, it can also be general feelings of loneliness, isolation, not feeling like they fit in, feelings of guilt. So medications can help with those aspects. Now, another way in which we can provide help is through group therapy. So again, group therapy is a place where individuals with the same issues or somebody who has overcome that same issue come together. So having a space where they can, openly talk about the difficulties that they face, the inability to control certain urges, that itself is healing in itself, to have somebody to talk to about that. Now, this being a disorder that not a lot of people can understand why it's done or how difficult it is for them, having a safe setting like that definitely helps the individual to explore certain ideas, how to overcome, hearing experiences of somebody who has already overcome. So that can help out a lot. Another one is social skills training. Now we see that exhibitionism is developed for certain individuals because they do not know how to have maybe an intimate relationship with an individual. So they go through a maladaptive means, which is exhibitionism. So helping the individuals to develop social skills, how to be intimate in a situation, how to have intimate conversations, how to have healthy relationships can also benefit the individual definitely in reducing certain of these urges that they have. And finally, family support and support otherwise. The individual already feels lonely. He does have a certain amount of regret that he or she goes through when going through this sort of disorder. So while that being said, having support can definitely help the individual to take more help, to help understand that, okay, I do have an issue that needs help, and while this is something difficult to talk about, I do have a supporting family who can help me through this. So having a familial support on how to get help, where to get help, how to go about, definitely helps the individual to take that first step into seeking help.